Welcome to another episode from the Veterinary Research Channel. Today, we delve into a fascinating study published in the Journal of Veterinary Internal Medicine in 2024. This research, conducted by Alejandro Perez-Acija and colleagues, explores the utility of a parameter known as the immature platelet fraction in a specific blood analyzer, the Sysmex XN-1000V. For the purpose of differentiating between two main types of thrombocytopenia in our beloved canine and feline companions. Thrombocytopenia, as the researchers explain, is a common laboratory finding in small animals characterized by a lower than normal number of platelets in the blood. This condition can be concerning as it may predispose animals to potentially life-threatening hemorrhage or spontaneous bleeding, particularly during surgical procedures. The process of determining the underlying cause of thrombocytopenia can be complex. Veterinarians typically consider a combination of the animal's history, clinical signs, and various blood tests, including the measurement of different platelet parameters. Sometimes, additional diagnostic tests like clotting times, serological tests, biomolecular tests, and imaging procedures are necessary to reach a definitive diagnosis. One factor that can complicate the interpretation of platelet counts is the occurrence of platelet clumping. This clumping can be due to improper blood collection or mixing of the sample with the anticoagulant ethylene tetracic acid, leading to a false decrease in the platelet count, a phenomenon known as pseudo-thrombocytopenia. It is crucial to identify this artifact by carefully examining blood smears for the presence of platelet aggregates. Once true thrombocytopenia is confirmed, it is generally classified into two categories: central thrombocytopenia and peripheral thrombocytopenia. Central thrombocytopenia arises from the bone marrow's inability to produce a sufficient number of platelets. This can be due to various factors such as cancer, infectious agents, hormonal imbalances, toxins, radiation, or certain medications. On the other hand, peripheral thrombocytopenia results from an increased consumption, destruction, or sequestration of platelets in the body, often seen in conditions like immune-mediated thrombocytopenia or spleen-related issues. The differentiation between these two categories traditionally required an assessment of the number of megakaryocytes, the platelet precursor cells, in a bone marrow aspirate or biopsy. However, the researchers point out that bone marrow sampling is an expensive, time-consuming, and invasive procedure, and the interpretation of the results can vary depending on the pathologist's experience and the quality of the sample. This is where the immature platelet fraction comes into play. The Sysmex XN-1000V analyzer utilized in this study has a specialized channel for platelets that uses a fluorescent dye. This dye binds to ribonucleic acid present in the platelets. Platelets that have been recently released into circulation are richer in ribonucleic acid and thus exhibit a higher fluorescent signal, allowing the analyzer to identify and quantify them as the immature platelet fraction. The researchers draw an analogy to reticulocytes, which are immature red blood cells that reflect the rate of red blood cell production. In human medicine, the immature platelet fraction has proven to be a valuable diagnostic parameter in distinguishing between central and peripheral thrombocytopenia. This parameter reflects the activity of the megakaryocytes in the bone marrow. While the measurement of the immature platelet fraction using the Sysmex XN-1000V has been recently validated in veterinary medicine, there was a lack of comprehensive information regarding its utility in differentiating the causes of thrombocytopenia in dogs and cats. Therefore, the objectives of this study were multifaceted. The researchers aimed to compare the immature platelet fraction as measured by the Sysmex XN-1000V among healthy dogs and cats, those with clinical conditions but without thrombocytopenia, and those with thrombocytopenia. They also sought to investigate the immature platelet fraction and different underlying causes of thrombocytopenia in both species, establish reference intervals for the immature platelet fraction, and assess the potential influence of age and sex on the immature platelet fraction in healthy dogs and cats. To achieve these objectives, the researchers retrospectively reviewed the medical records of a large number of dogs and cats that were presented to the Veterinary Teaching Hospital of the University of Córdoba between January 2021 and May 2023. All animals included in the study had complete medical records and had undergone a complete blood count using the Sysmex XN-1000V analyzer. The dogs and cats were carefully categorized into healthy groups, clinical patients without thrombocytopenia, and those with thrombocytopenia. The thrombocytopenic animals were further subclassified as having pseudothrombocytopenia, central thrombocytopenia, or peripheral thrombocytopenia based on a thorough evaluation of platelet clumps on blood smears, estimated platelet counts, and their final diagnoses. Blood samples from all animals were analyzed using the specific platelet channel of the Sysmex XN-1000V. Turning now to the results of this comprehensive study. The researchers found that the immature platelet fraction was significantly different between each subtype of thrombocytopenia in both dogs and cats. Importantly, they determined that in dogs, an immature platelet fraction of less than 6.9% after ruling out pseudothrombocytopenia through blood smear examination was indicative of central thrombocytopenia. In cats, a corresponding cutoff of less than 13.6% suggested a central origin of the thrombocytopenia. The study also established reference intervals for the immature platelet fraction in healthy animals. In healthy dogs, the immature platelet fraction ranged from 0.5% to 8%, while in healthy cats, the range was much wider, from 1% to 40.3%. The researchers also examined the potential influence of age and sex on the immature platelet fraction in healthy animals but found no significant differences related to either of these factors in either dogs or cats. When comparing the immature platelet fraction among the different groups of dogs, the researchers observed that the immature platelet fraction was significantly higher in dogs with thrombocytopenia compared to healthy dogs and those with clinical conditions but without thrombocytopenia. Furthermore, within the thrombocytopenic group, dogs with peripheral thrombocytopenia had significantly higher immature platelet fraction values compared to those with central thrombocytopenia. Dogs with pseudothrombocytopenia also showed higher immature platelet fraction values compared to the central thrombocytopenia group, although these values were lower than those observed in the peripheral thrombocytopenia group. In cats, the findings were similar. While there were no significant differences in overall platelet counts or immature platelet fraction between healthy, non-thrombocytopenic clinical patients and thrombocytopenic cats as a whole, when the thrombocytopenic cats were further divided, those with central thrombocytopenia had significantly lower immature platelet fraction percentages and immature platelet counts compared to those with pseudothrombocytopenia and peripheral thrombocytopenia. Cats with peripheral thrombocytopenia showed the highest immature platelet fraction values. The researchers also performed receiver operating characteristic curve analysis to assess the accuracy of the immature platelet fraction in distinguishing between central and peripheral thrombocytopenia in both species. This analysis demonstrated that the immature platelet fraction was indeed accurate for this differentiation in both dogs and cats. They were able to determine specific cutoff values, sensitivity, and specificity for the immature platelet fraction in identifying the underlying cause of thrombocytopenia. Notably, in dogs, another platelet parameter, the platelet large cell ratio, lacked the necessary sensitivity and specificity to reliably differentiate between central and peripheral thrombocytopenia. In their discussion of these findings, the researchers concluded that the immature platelet fraction, as measured by the Sysmex XN-1000V analyzer, can indeed differentiate between central and peripheral thrombocytopenia in both dogs and cats. This valuable information can guide veterinarians in selecting further diagnostic tests and potentially help in avoiding more invasive procedures such as bone marrow sampling in certain cases, depending on the immature platelet fraction results. They emphasize, however, that a blood smear should always be carefully evaluated to rule out platelet clumping as a cause of a low platelet count. Once pseudothrombocytopenia is excluded, the immature platelet fraction can serve as a rapid and reliable technique to aid in the diagnostic workup of thrombocytopenic patients. The observation of higher immature platelet fraction in dogs and cats with peripheral thrombocytopenia compared to those with bone marrow disorders reflects the body's attempt to compensate for increased platelet destruction, consumption, or sequestration by increasing platelet production in the bone marrow. This finding aligns with observations in human medicine where similar patterns have been reported in conditions like immune-mediated thrombocytopenia compared to bone marrow failure. The study also noted that animals with pseudothrombocytopenia exhibited higher immature platelet fraction compared to those with central thrombocytopenia, a phenomenon that has been previously observed. This highlights the importance of always evaluating a blood smear in thrombocytopenic patients, as the immature platelet fraction alone cannot reliably distinguish pseudothrombocytopenia from other causes. However, once pseudothrombocytopenia is ruled out, the immature platelet fraction showed high sensitivity and specificity in differentiating between central and peripheral thrombocytopenia using the established cutoff values. The researchers point out that the cutoff values they found in dogs are similar to those used in human medicine to differentiate between immune-mediated thrombocytopenia and aplastic thrombocytopenia. Furthermore, they suggest that the immature platelet fraction could also be useful in monitoring thrombocytopenic patients during treatment as an indicator of platelet recovery. While other platelet parameters like mean platelet volume and platelet distribution width have been explored as potential surrogate markers for platelet production, the researchers in this study found no significant differences in these parameters between the different types of thrombocytopenia in dogs. Moreover, they noted that impedance-based methods for measuring these parameters can be unreliable, especially in cats due to platelet clumping and overlap in size with red blood cells. Since the immature platelet fraction is based on fluorescent signals rather than impedance, it offers a more robust assessment of immature platelets. Although the platelet large cell ratio was higher in dogs with peripheral thrombocytopenia, it lacked the necessary sensitivity and specificity to be used reliably for differentiating between central and peripheral thrombocytopenia. The establishment of reference intervals for the immature platelet fraction in healthy dogs and cats using the Sysmex XN-1000V is another important contribution of the study. By separating healthy animals from those with non-thrombocytopenic clinical conditions, the researchers aimed to avoid potential bias, although they found no significant differences in the immature platelet fraction between these two groups. They acknowledged that comparisons with reference intervals from other studies should be made cautiously due to variations in the dyes and techniques used in different analyzers. However, the reference ranges they established for dogs are similar to those reported in other studies using the same or different methodologies. The wider reference interval observed in healthy cats warrants further investigation to understand the underlying reasons for this species-specific difference. The lack of significant differences in the immature platelet fraction based on sex in both species aligns with findings in human medicine using similar hematology analyzers. While the study did not include very young animals, the researchers suggest that future studies could explore immature platelet fraction values in puppies and kittens of different ages, as age-related variations have been observed in human neonates. They also acknowledge that breed-specific differences, such as the idiopathic asymptomatic thrombocytopenia seen in Cavalier King Charles Spaniels, could warrant further investigation. The authors also discussed some limitations of their study. Some conditions causing thrombocytopenia can involve a combination of reduced platelet production and increased platelet destruction, which might complicate the classification into strictly central or peripheral causes. The study primarily focused on the broad differentiation between central and peripheral thrombocytopenia without extensively analyzing variations in the immature platelet fraction among specific diseases within these categories. Additionally, the retrospective nature of the study meant that not all diagnostic tests were performed in every animal, and some animals were excluded due to incomplete data or lack of a definitive diagnosis. Finally, accurately quantifying the effect of aggregates on platelet counts in pseudothrombocytopenic animals remains challenging. Despite these limitations, the study provides strong evidence for the clinical utility of the immature platelet fraction in the Sysmex XN-1000V for the differential diagnosis of thrombocytopenia in dogs and cats. The established species-specific cutoff values offer a valuable tool for veterinarians in distinguishing between central and peripheral causes of this common hematologic abnormality. The researchers reiterate the importance of always examining a blood smear to rule out pseudothrombocytopenia before interpreting the immature platelet fraction. The newly established reference intervals for healthy dogs and cats provide a foundation for the clinical application of this parameter, and the finding that these intervals are not significantly influenced by sex or age in healthy adult animals simplifies their interpretation. Thank you for listening to the Veterinary Research Channel. A link for the referenced paper is in the video description. Remember to test your knowledge by answering the questions in the description, and as always, keep those minds inspired, hearts light, and tails wagging.